Hello and welcome to this OET introduction class. Today we're going to be studying something called paragraph function. Can everyone see this screen saying paragraph function? Can everyone see that?
Yes.
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 Great.
Yes.
And guys, can you now see my my Word document? Paragraph function.
Yes.
Yes.
Fantastic. All right, so this is the plan for today. Maybe if we can just get someone to walk us through it. Maybe Rijwana, could you just talk us through what we're trying to do today?
So we're gonna talk about the paragraph functioning, how it works. So maybe I can see from your writing, then we're gonna quickly go through over the OET sandwich and then examples of mixed paragraphs.
Yeah.
So maybe the request paragraphs and body story paragraphs.
Yeah, exactly. That's the idea. So we're just going to thank you. That was probably one of the best reviews I've ever had from someone. That's what we're trying to do. We're trying to basically look at different paragraph types. Okay, but I call it paragraph function, and I think you'll see why. Okay, you'll see why as we move forward. So let's get started. If I say your name, you just need to put on your microphone and try to answer my questions. Step one is review of the format of the test. This is the OET writing test. So let me ask Han, if you wouldn't mind just for some of the newer students go through the basics of the test. What are they asking us to do?
They ask us to do to write a letter.
Okay.
Yeah.
And what else? Tell us something more.
It depends on the kind of letter. Sometimes it's for a nurse, for healthcare professional, for specialists. There's normally 3 times. It's discharge.
Types of letter. Good. Okay, let's do that. So there's types of letter. You got discharge letter. Good. And
referral, transfer,
and transfer. These are the main ones, but there are probably others, aren't there, Han? Like pre-operation.
Yeah.
Procedure transfers.
Procedure transfers. You see that. Anyone else seen anything official looking, but that's slightly different from these? You can shout it out. What else have we got?
Some are like
45 minutes.
right?
In terms of types, anyone?
Discharge, transfer, mixed.
There's like a mixed. Yeah, we saw once, didn't we? Like it was like a transfer and a discharge. Was it at the same time? Kind of. Yeah, but these are the 3 main types, aren't they? And we're not studying types today, but anyone who's new to OET, start off by learning what we mean by this type of letter and maybe looking at some examples because they're quite distinct, okay? In terms of time, I know it's silly, but let's just shout out, how much time do we have for the writing as a whole?
45.
Come on, guys. Yeah, 45
minutes.
Thank you very much. And if I ask just one of you to explain what happens in the first 5 minutes, maybe Mary or Viorica, anyone who doesn't know OET, in the first 5 minutes, what do they say?
You're going to down.
Pen down. Pen down, right? And what do we just do for 5 minutes?
I'm going to read the whole case note.
Yeah. So first 5 minutes, pen down. Just reading and just reading. Okay, I think that's the basics of basically what you're facing when it comes to OET writing. 45 minutes in total, 5 minutes of just reading, no pens. You can expect in the exam to get one of these 3 types of letter, although just like any exam, sometimes they throw you a curveball or they try and change it a little bit to make everyone feel uncomfortable. One of the good things about OET grading is that they alter the pass marks are based on, does anyone know what I'm talking about here? The pass mark is based on an average. What does that mean? Let me ask someone specific, maybe Mukit, if you're there.
Yes.
Pass mark is based on an average. In general, in OET, it's based on averages.
Yes.
What does that mean?
Is it 28 to 32 if the task is too much hard?
Mm-hmm. That's the reading and the listening, isn't it? The passing grade can be 28 or 27 or 29. But in writing, I think it's the same. It just means, Mukit, they're going to take all the letters in and they score them and
Mhm.
they do adjust the grade boundaries. Okay.
Okay.
So
Okay.
so for example, Mukit, if we get a really difficult set of case notes
Mhm.
and everyone finds it difficult, what will that
Mhm.
mean?
Mm, Then they will lower the pass mark, I
Yeah,
think.
they'll lower it. Yeah, they'll lower it slightly, right?
Mhm.
If they're really easy case notes, by the same token, they're going to take the passing mark
Pass mark high,
slightly higher, right?
slightly higher.
So
Yeah.
it's an Australian exam. They take all the
Mhm.
data in, and
Mhm.
that's what I've been told that they do averages. Whenever we've tried to ask them specifically about the writing, they always say it's very complicated, and we have two people
Mhm.
marking your essay, and there's an algorithm that all this stuff, but basically
Mhm.
there's no fixed mark. So I think that's good to know. It's fairer. If we get difficult, if you get difficult case notes, everyone
Mhm.
will struggle, not just you. All right, so let's just say that's the basics for the format of the test. All right, let's move on now to talking about the next thing in this class. Okay, so microphones off, please, guys. Just have the microphones off. I want to talk now about paragraph function. Okay, so the second part of this class is all about paragraph function. Does anyone know what I mean by paragraph function? Something that I say in class sometimes. I don't usually bother to explain it. Maybe Karen or Susmita or maybe Carol? What
Yeah,
does that mean, paragraph function?
maybe it means the function of the all paragraph, each paragraph.
Each paragraph has like a function. So
Yeah,
what's a good synonym for each paragraph in OET has it's useful to think about the functions of the paragraphs. But what does that mean specifically?
I think it's the details that you include in a specific paragraph.
That will help. That will help. Well, if you get clear about the function, then you know what details to put in to the paragraph. That's kind of the idea. Let me show you guys, all right? So I made a silly thing. It's like a silly piece of writing. But, you know, every text, doesn't matter what it is, it's got a function, hasn't it? Otherwise, why would you write it? So this one here, if I just asked Joshna, are you there, Joshna?
yes.
What is the function of this paragraph? First, you crack about 3 eggs into a bowl. Next, you mix them together. What's the function of
Sorry for
this?
that. Making crumble egg.
Yeah, it's telling the reader what? It tells the reader how
How to make the
to
crumbled egg.
make. Yeah, and I'm glad that you know this is scrambled eggs because not many people would know that. Okay, yeah, scrambled eggs. What about we could just call this, couldn't we? Is this something like a recipe, maybe?
Yes.
Yeah, a
Yes.
recipe. But I'll just leave it like that, just in case anyone, just to keep this clearer, right? So, the function of a paragraph like this is to tell the reader how to make scrambled eggs. Simple, right? Okay, let me show you another paragraph. And again, you tell me the function of this paragraph. Hi, John. Please remember to feed the cat. Also, the rubbish needs to be taken out on Wednesdays, so don't forget. Joshna, if you could put your microphone off, and I'll just ask this question now to someone else. So, Joshna, microphone off. Isabel,
Yes, Alan.
if I said to you, obviously you know what the function is, but how can you just tell me what it is? What we're trying to do with this paragraph here?
It's like a routine.
It's kind of telling the reader, yeah, like the routine, yeah, to do some routine actions.
Yeah.
Maybe why do we tend to write this kind of letter? Maybe the writer is on holiday, right, or is away somewhere.
Yeah.
Okay, but the function is telling the readers to do some routine actions, such as feed the cat, and what's the other one? Feed the cat and
Rubbish. Rubbish.
Rubbish.
chores, isn't it? Chores, some routine actions, stroke chores. Okay, so you get the idea. Paragraph function is just the reason why you're writing. Okay, let me show you another one though. Okay, now we're getting a bit more into OET territory. Please ensure Mr. Green follows his new dietary advice. Mr. Green was admitted to our hospital last week Mr. Green will also require monitoring of his wound as well as regular bandage changes. One thing I've just noticed, is that good writing, guys? Don't think that's good writing, because there's lots of repetition of the name, isn't there? So what can I write?
No.
What should I put here? First time in a paragraph, we use the name. Second time, we use
Pronoun.
pronoun, like he. And then all the other times inside the same paragraph, we can use this. And if I ask Rika,
Yes,
you
sir.
can just, what's the function of this?
What happened first, then second, he was admitted to hospital last week. And now what we are doing, he
Are you sure?
needs,
Is it telling me the sequence of events in the past? Are you sure?
no,
No.
like in
Telling
a
the reader.
discharge, like a discharge letter.
Yeah, it's telling the reader to, if I say please ensure.
What he will do next.
What he should do, he or she,
Yeah,
right?
yeah.
He or she must
Monitor
do
his wound
next
and
for the
bandage.
patient.
Yeah.
So we all know that it's this type of, when we say, what's the name of this paragraph, guys? What's the typical name in OET? We call this a
Request para.
right? Thank you. Microphone's off. Good. Just have the microphones off. So yeah, a request paragraph. What we're saying is that the function of this paragraph is to tell the reader what to do next. All right. Let's look at this one now, though. This is an interesting one. I'll read it to you, and you guys tell me what is the function of this paragraph. So, following his operation, Mr. Baker experienced disorientation, which was probably due to his anesthesia, but no signs of dementia were observed. Please ensure that he is monitored regarding this for the next 2 weeks. 1 week after the operation, Mr. Baker had a blood transfusion because his hemoglobin level dropped post-surgery. Currently, he's recovering well. I'll ask just one of you again. I'll just put your microphone on. Viorica, are you there? No, Viorica? Maybe Eugenia? Just give them the time. They're probably going, oh, where's the microphone? Viorica, Eugenia, no? Just trying to bring you into the class.
Yeah.
Okay, go on. So the function here is what?
Is to inform the reader about the current situation, you can say.
Tell the reader. Okay, so I'll just put telling the reader about the current situation. Telling the reader. Maybe one of the reasons why you're confused.
Hospitalization.
Yeah. Okay. So about the hospitalization. Okay.
Yeah.
But I can understand why you're hesitating, because it's not very clear, is it? Why? There's actually a mistake here. I regard this as a mistake. Like it's not.
Please ensure that he's monitored regarding this for the next 2 weeks.
Yeah. Right. So this is what I call a mixed paragraph, mixed function. And it's because they've put this sentence in here. And why is, if we say that the function of the is telling the reader about, let's just say the past events in the hospital, right?
Yeah.
Just to make it clear. Otherwise known as a story, it's usually something like a story paragraph, right? Why is it not a good idea in the middle of your story paragraph to tell the reader what to do next? Why is that bad writing?
Because it's a little bit confusing.
Confusing.
You're talking about the operation. After that, please ensure. And after that, again, 1 week after the operation has blah, blah, blah.
Yeah, that's a good answer. Can anyone else give me another answer? There's loads of reasons why it's not a good idea to put it right in the middle of your story. Anyone else want to try? Maybe Mittal, microphone on if that's okay. Or we could try maybe someone like Alexandra.
Yeah.
Not a good idea to do this, is it? But why?
I think the reader will lose the focus.
Loses focus as well?
Yeah.
Yep.
About what he's going to do, the reader.
All good at things. Any more, guys? So you lose focus. I'll write that one down. Sorry, I forgot to write the other one.
Lose marks.
You could probably lose marks for, is it well organized?
Yeah.
Clarity.
Lose marks for
clarity.
organization
Clarity.
and layout. right? Why do we organize things? So it's easy for the reader to understand. Well, why are we're doing this? It's not easy to understand. But I think another key reason, it's not even really in the exam, is if you're reading, imagine you're reading a letter, okay? And you know that letter is asking you to do something. Where do you want all the things that you have to do? Do you want it at the beginning, middle, or end of the letter?
At the end of letter or
Paragraph.
So here, it's almost hidden, right?
Yeah.
An important thing that they must do is hidden in the middle of a story paragraph about past events.
Yes.
Right? The important thing that is the important thing that the reader must do is almost lost or hidden inside another paragraph. Okay, so we don't want to do this. This is one of the first things that when we started teaching OET, we were trying to figure out, I think, me and Paul, like, what's going wrong here? What is it students don't get? And I think this was, for me, like a light bulb moment. Like, it's because they're not thinking about paragraph functions clearly. Because think about it, although this is bad, doesn't it make sense? When he says, please ensure that he is monitored for this, Han and Sabrina, if she's there, please make sure that she's monitored for this. What does that mean, this? Monitored for what? Yeah. So it makes sense, doesn't it? I mean, it seems relevant to put it in that paragraph because the two sentences, they're connected, aren't they? Right? So I understand why people, when they start doing OET, they think, oh, well, I'll just talk about the monitoring in the same paragraph as the dementia because they're connected. You should monitor for the dementia, right? But it's a mistake because it just causes loads and loads of confusion, right? Here, it's actually not that bad. I don't mind it, actually. But a small mistake like that, if you do it too much, you'll score badly because the reader will be confused. Okay, I'm going to show you a great example of this now. Okay, a real example from one of you, actually. Okay, I'm not going to say who it is, but I'll show you this example, and then you'll see something. I've got two examples really, and I think it's really good. I hope you like this because I think this is really good. So let's think about mixed paragraphs. Have you guys heard of Helen Martin before?
Yeah. Yes.
They've been studying Helen Martin all week. We started on Monday, right? But just quickly, anyone who's new to OET, maybe you're just watching this video and you weren't in those classes. Can someone summarize Helen Martin for me? If I say your name. So for example, if I say maybe Carol, I don't know if you've been in the classes actually, Carol, but Ridwana or Mariam, could you summarize, one of you guys, or together?
Yes.
Who's Helen Martin?
Miss Helen Martin is 81 years old woman. She had angioplasty in the past, and now she did angioplasty for the second time following angina.
So the issue is angina. She's really old. She's 81. Good. And what type of letter is it?
It's a discharge letter
for
a nurse.
Yeah, that's well remembered. She's 81. That's great. Okay, discharge letter. This basically, let's just say angina. Okay, for this instance. Don't worry, everyone. I'm not going to talk a lot about this. It's just an example. Okay, so let's think about let's just think about these case notes again. Let's think about the background here, guys. Let's just make sure we pay attention to this. Can someone summarize the background very quickly? Don't spend too long. Maybe Satyabanu, if you're there, or Clara. Could you summarize the background of this lady?
Yes.
She got lots of people taking care of her. Is that true?
Yes.
She has lots of people. Or what about her family?
Really?
She lives alone because she never married. And she don't have
regular contact with her family.
Good. She doesn't have regular contact. Good. And the food? Meals on wheels, right? Okay, good, guys. So let's just stand back and think about this lady. So she's 81 years old. She went into, the story is that she went into the hospital to have her angina dealt with. What, has she had problems with angina before? Do you guys remember?
Yes.
So yes. She had an angioplasty in 2008, didn't she? Remember?
Yes.
Yeah.
Yes.
So let's just get those things in our minds now, guys. So on the one hand, we know she's had 2 angioplasties. She's very old. It's a discharge letter, so she's coming out of hospital. And one of the big things about these case notes is that she doesn't have any family to take care of her. That's kind of do we all agree that's the basic situation? Yes?
Yes.
Yeah. Okay. So now I'm going to show you an essay. It's the handwriting is amazing. I'm going to show you this essay, and I want you to analyze it from the perspective of paragraph function. All right? I'm not going to tell you if it's good or if it's bad. You tell me is this person doing good paragraph function or bad paragraph function? Are they separating things out or are they mixing them? Okay, are you all ready?
Yes.
Yes.
Here we go. Look at the handwriting here. This is amazing handwriting. Okay, I'm not going to say who this is. All right.
Wow.
But what amazing handwriting, eh? I love that. Let's just pay attention though to, in many ways, it's a really good letter as well, right? This is a good letter, but what about paragraph function? What do we think? I might pick on one of you to analyze this actually. Maybe Catalina, or who have I not asked? Catalina and Carol.
Hello.
Okay, so what do we think of this? What's your opinion? Maybe I should give you guys a bit more time to read, actually.
To read on.
Okay, sorry. Just take a minute now, guys. Just relax. Think like an examiner and ask yourself, is this person organizing the letter well? How are the paragraphs working? And then I'll ask you. So just read.
She's having a very short introduction, and then I have the feeling she mixes like the story with the
Background.
Yeah, thank you, Catalina. Right. I don't want to rush people though. Sometimes I rush a little bit. So can we all see that there's a little bit of mixing here?
Mm-hmm.
It's not that it's a bad letter though, right? So this is why I love this example, because it's just such a small thing. So Patricia, can you see the mixing?
Yeah, I've been reading that, and yeah,
so let's which paragraph is the most, well, there's only one paragraph where there's the mixing. Where is it? Here, or here?
The second one.
The second
story.
So let's analyze this together, right? So what is the mixing? Han, maybe you can help us out with this. The first sentence, Mr. Martin was a Mr.
Yeah.
So that's telling us, what would you call that? Some kind of
topic sentence?
It's a topic sentence, and it's telling us about the
admit to hospital.
Yeah, so it's almost like the story of the hospitalization. Hospitalization. So I read that sentence and I go, okay, so we're going to hear the story of the hospitalization, yeah? And then we've got post-operatively, the bruises, okay. That's after the operation in the hospital. What about sentence 3 though, guys? What do we think about that?
Medical history.
Medical history should be separate.
That should be in the background.
Well, this is what I mean. I'm not going to say hard and fast, you should never do this, this is terrible. But already we can see that, yeah, this is 2008, isn't it?
In 2008.
So now I'm thinking, when did this happen? Because there's no date here, right? All I know is that sometime in 2008 there was the first one. Okay, so it's not great, but then let's move on. There's some more mixing. Let's get some people to analyze this. Maybe Rika?
Yeah, sir, in
More, isn't there?
2008, in or on? In
Yeah, well,
2008.
it should be in, yes, but I'm focusing more
Yeah.
on this one
Yeah.
thing. What
So
about this? Are you happy with that?
Because it is a like old diagnosis.
So we've
I
got
think put in the
hypertension there.
yeah, separate paragraph.
Okay, I get that we should separate this out, but let's think
Yeah.
about this in more detail. So we've got this seems to be like a long
Yeah.
time ago, so we'd
Yeah,
usually
yeah.
call that background,
Past.
wouldn't we?
Yeah,
We've
background.
all been saying background, right? We
We're
usually
not
separate.
even.
Yeah.
Sorry, I'm thinking we are not even sure if this is the current medication or is
Yeah, exactly.
previous.
So this is why it
Past
gets
and
tricky,
present.
right? Yeah,
Yeah.
exactly. So, and then we've got some drugs, the medication,
drugs
right?
names.
The medication here,
Medication.
and that kind of stuff. What about this? In addition, she has coronary artery disease. What about that?
Show background.
This is the like
Medical history.
This
Yeah.
kind of like came before the angina,
Yeah.
right?
Mm.
So we start with the going into hospital for angina, and then sort of by the middle of the paragraph, we're right back a long time ago in the
Yeah.
background still. And then it says in regards to her social background.
Social
Okay,
background.
so now we've moved from medical background to social background, right?
Yeah.
Suddenly we're in the present tense. She is unmarried. So do you see here how it might be unclear, right? We're not criticizing this person. It's a nice letter, actually. But does everyone see how if you don't pay attention to paragraph function, it's unclear?
Yeah.
Yeah? I'm not being unfair, am I? I'm just saying this thing. Now, some people sometimes say, well, that's just paragraphs, Alan. That's just what we do. This is just normal paragraph, right? Why do we write normal? What's the rule for paragraphs? Can anyone
Give a
tell me
clear
the normal
picture.
rule? Yeah, but why do we separate out things for paragraphs? Maybe Han can tell us,
Yeah.
or you can tell me what Key. Maybe why do we usually do paragraphs?
Clarity.
Unclear.
Yeah, but what's the rule? How do you know when to start a new one?
To separate background to story.
That's in OET, but let's step back. Let's go just in general, the most general sense. Why do we write? Why do I separate things out in paragraphs?
Separate
To
idea.
be clear.
To give clear idea to the reader.
The idea is topics and ideas. We separate topics and ideas.
To
right?
keep it organized.
Well, yeah. But I'm not teaching you how to make a paragraph today. You all know that, right? You separate out different topics and different ideas, right? But in OET, the reason I'm saying paragraph function is because I completely understand why this person has mentioned the angioplasty. Don't we all think that's actually quite reasonable? What's the topic of the paragraph?
Angioplasty.
It's having an angioplasty, right?
Angioplasty.
So I completely understand why someone would think, I'm going to talk about the angioplasty in 2008, right? Because that's how you do a paragraph. You do the same topic, yeah? But in OET, it's slightly different. You're not thinking about the same topics. You're thinking about paragraph functions. And the function of this, even though it's the same topic, it's not the same function, right? You got to decide, am I telling the story of the hospitalization? Or am I going to tell you about a long time ago, the history, long time ago, the social background as well? Right? You have to separate those things out. Does that make sense, guys? I feel like I'm giving a speech here. Yeah? It's all about thinking about what am I trying to do in this paragraph? Am I telling the story of the hospitalization, or am I telling about the patient's background? Keep them separate. Yes, any questions? Because I'm going to show you something new.
Can I ask you about this word, like her medical history traces? What they mean?
Yeah. Well, there's a few language issues. Yeah, so traces is not the correct word here. I think that she wanted shows, something like that.
Okay.
Yeah. Okay, but this is what I really like now. The reason I've done this, I'm not saying this person's name, and I hope she's okay with me doing this, because I just said to her, like in 2 minutes, what I've just said to you, okay? And she rewrote the essay. Let's have a look. Here's the second one. All right. Again, 1 minute, read it and just ask yourself, is this better, worse? How much better? Okay, so 1 minute, the same letter rewritten, same person, but this time thinking about paragraph function. When you finished, just type in the chat box. Just say hello, just say finished. Don't want to rush you. Just think about how much, obviously I'm going to say this is better, aren't I? But just think yourself how much clearer this is now, right? Paragraph 2 especially. Just type in the chat box when you've finished. Don't want to rush you guys, so you can just type in the chat box when you're done. Okay, so Mittal's asked me, do we need to mention past medical history because it's already done and recover? Well, Mittal, we decided some mention of past medical history is sometimes necessary. It depends, though, Mittal, on who you're writing to. You need to think about the reader. We decided we'd just mention some basics about the background. Okay, guys, I think one person's finished, and I'm not very patient. Clara Alexander. Okay, so
Done.
is it better? Come on, guys. It's much better, isn't it?
Yes.
Yes.
It's miles better.
Yes.
And this person is I didn't have to really explain it very much. Think about paragraph functions, separate out the background from the story, don't mix them together. I know she's had two angioplasties, but one happened in 2008, it's a long time ago, right? So this is the idea of paragraph function. If you don't do it, if you, I'm not saying that you can't be really clever and mix a little bit. You can mix a little bit, right? Very high level writers, but if you get it wrong, you get something really confusing like this. It's jumping around in time, it's going into the present tense, it's going to 2008, hospital, right? Totally unclear, not going to score highly in terms of organization or coherence and cohesion. Is that the IELTS one? I always confuse them. Conciseness and clarity, that's right. Okay, so you see the two examples, all right? But I want to show you something more now, okay? We've seen a real example. I've showed you dead simple examples. I want to talk now about something called the OET sandwich, right? And I want to explain why it's all related. So the OET sandwich may be Mukit. It's just a silly thing. It's a very stupid thing that I say. Do you know what it is, Mukit?
Yes, I know.
So can you tell us, what is the OET sandwich?
Yeah, we have a introduction initially.
Is the basic idea.
First para.
We always need an intro.
Intro, and the last para we have a request. And there's the two bread of the sandwich.
Paragraph, and we always need
request.
A requests paragraph. Okay. And you can get, that means you can practice writing them fast and learn the grammar really well and stuff, increase your speed, right? But let's think about this in terms of paragraph function now, right? Your introduction, that's a paragraph function. So what's the function of an introduction?
The purpose?
To give the purpose of the letter, thank you. And to give the overall
Main idea.
Situation, right?
Yeah,
So I'm
sure.
writing regarding Mrs. Jones, who was admitted to our hospital recently due to a broken arm following a car accident. I've given the name. We know where she went. We know what the injury is. That's like the situation, isn't it? And then I say she's being discharged today, and she now requires further care and support. I'm telling you the purpose of the letter, right? So that's a paragraph function. Paragraph function of an introduction
Immediately apparent.
is immediately apparent, situation and purpose of letter. Okay, that's your sandwich. What's the purpose of the final paragraph? The request paragraph. What are we trying to do? Sorry, yeah, go on.
So
What's the paragraph function of a request paragraph? We're trying to tell the reader
what they need to do next.
She need
tell them
to do
what to do next, right?
A plan.
Do next. And if you find yourself writing something else in that paragraph, then you should ask yourself, why am I putting something else in there? Again, I'm not saying that you can't. Yeah, I'm not saying that you can't sometimes mention extra things, but the function of the final paragraph is to tell them what to do next. The function of the intro is to give situation for me and purpose of letter. Okay. Any questions about the OET sandwich? I don't think it's very complicated. It's just I want to say something else.
Can I ask?
Anyone have any questions? Yes.
For example, in the introduction, I will write like assessment and management. We have to use both words same, assessment and management, in the request paragraph?
That's a great question. And I think the answer is use the words from the case notes. If it says assessment,
yeah,
use
both
assessment.
Yeah.
Or a synonym of assessment. Can anyone give me some synonyms?
Investigation.
Evaluation.
Investigation.
No.
Evaluation.
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 Be very careful with this, because if you get it wrong, you're telling the reader to do something that's wrong, right? If I say treat and you write manage, that's really bad, because those are different things. Okay, so yeah, great question. Use the pay attention to the case notes, and don't deviate. Try to use the words or synonyms. Any other questions?
No, please.
Alan, I have a question. Most of the time, I do mistake with please note that. Why shall I, where I need to put please note that? In the request recommendation?
Great question. Can anyone answer that? Does anyone do I have to say please note that only in the requests, guys?
No.
No. Anywhere apart
Anywhere.
from the introduction.
It's actually kind of useful anywhere, but we just use it more often at
can
the
use
end.
in the story.
Yeah.
Or
Let me just finish this. And
any particular note.
So the answer to that is you can use it anywhere in your letter. It's just that very often you use it in your request paragraph. Okay. Yes.
What about if the patient is a young age, or her mother brought him to the clinic? So in this case, what can I say in the introduction? Like, who's her mother says, like?
It depends, right? And I don't want to go into this too much, because there's no general rules often for these things. All I'm saying, guys, is these are your paragraph functions that you know already, even though I've spelt situation wrong. Thank you for telling me. Situation, is that right? Situation? Situation.
Yes.
Let's not focus on detail like that, Mariam. Instead, what I want to do is, as long as everyone's okay with this basic idea, is point out, okay, that there are other paragraph functions, aren't there? You know the introductions, you know the requests. They are paragraph functions, though. But what other paragraph functions do we have? Let's think about it. In your sandwich, let's think about the OET sandwich. So we talk about the OET sandwich because what goes inside a sandwich? Is there something specific that goes inside a sandwich?
Timeline paragraph?
No.
Well,
story.
Sandwich. Oh, I'm going to stop typing. I am a terrible typer, guys. I'm really sorry. I type like this. But the point is simply this. I use this idea just to say that you can change your paragraphs around inside your sandwich, right? So you always need an intro, you always need a request, but if you want a story paragraph as paragraph 2, that's fine. But maybe you want a background paragraph as paragraph 2. It's your choice, okay? Just like in a sandwich, it depends. Whatever you want to put in a sandwich, you can put it in between those two things. But you always need an intro, and you always need a requests paragraph, right? These are all paragraph functions. Let me show you some more functions though, okay? This is what I'm trying to work into. Common paragraph functions, right? So the end of this class will be just us talking about different types of paragraphs you can write and what you need to do in those paragraphs. So it's kind of like a test as well, but very easy. What does it say here? I'm writing to refer. What type of paragraph is that, guys?
Intro paragraph.
It's obviously
Introduction.
introduction paragraph, right? And I've just spoken about that. I'll speak about that again in a minute. What about this one? Today,
Story.
The removal of variety was tried twice, which was successful.
Story.
It's kind of like a story in the past, right? But is it? I want to say that this is a slightly different paragraph, actually.
It's more.
If I say today, if I'm only talking about today, I am kind of telling a story, but I'm also talking about the
current situation,
right? It might be useful to just separate, have that as a, yeah. So the function of that paragraph is, I'm just going to tell you about the today, right? What about this? In terms of medical history, she has diabetes.
Background.
Okay.
Background.
Does it have to be always medical, or can I do social as well?
Social.
Yeah, you can put both.
Is she doing both in this one?
Yeah, she did.
Yeah. Socially, she is a widow and lives alone, right? Okay, so we've got current condition paragraph function. We've got background paragraph function. What about this one? What paragraph function is that?
Right.
We've got lots of dates.
Story.
Past. This is what we mean by a story paragraph, or probably more accurate is a timeline paragraph. Right? We're moving from the past into the present. Okay? So look, we've got paragraph functions, we've got introductions, we've got request paragraphs, but we've also got a current condition paragraph, I think we can talk about. We've got background paragraphs, we've got timeline paragraphs. What about this one? This dead easy one.
Request.
Do the request one. Okay. So for the rest of this class, I just want to talk about what makes a good paragraph like this. What do we have to do in them, right? So I just said this before, but I'm going to ask one of you, see if you were listening. An introduction paragraph, Susmita.
Yeah.
And what were the two things that I said an introduction paragraph needs?
Purpose.
Purpose of letter. Good.
Yeah.
And?
To whom we are writing.
Yeah. To whom, and also they were in a hospital and the injury. So what's that?
What we have to do next.
Action.
If I say, this is his name, this is where he is, this is his injury, what am I doing?
Situation. Information.
The situation, aren't I? Yeah, I'm just telling the situation, the basics. Okay. Any other things you want to say about an intro paragraph? Should it be long or short, guys?
Short.
It should be really short. Why? Why should it be short? What happens if I make a really long intro?
It may be confusing.
Yeah. Do you find it really simple when someone tells you loads and loads of information all at once?
No.
No, it's complicated, right? So try to make it short and clear. Okay. Let's think about a background paragraph. Han, what's good to put in a background paragraph? What are we trying to do here?
The background paragraph have maybe two parts. One is history,
like
of
history,
medical. Yeah.
From a while ago. Yeah. Usually, yeah.
Another one is background, social background.
Social stuff. Yeah, social information, which could be still true now, right? It's not even in the past. Like it says here, she is a widow, right? What tense is that?
Simple present.
Present.
Simple present. Well, we might say, Han, can you give us an example of something you might say from a long time ago?
He was diagnosed with diabetes for 10 months.
Yeah. Well, you could say he was diagnosed with diabetes, let's say 10 months ago. All right. Because that's just past simple. So this is the kind of thing. Now, you can put them in the same paragraph. Is everyone okay with the idea that you can put them in the same paragraph, even though one's about social and is in the present tense, and one is usually past simple? Is everyone okay with that? How do I put them in the same paragraph? You don't have to, but you can have two background paragraphs if you want. But I just need to have a phrase, don't I? I just need to say, tell the reader. So I might say, in terms of, yeah.
In terms of her medical history.
The medical history. You can see in the example, this is what she says, right? This is a really good letter from one of our students, Tinsy. She's going in on Saturday. So good luck, Tinsy, if you're watching this. But then when she wants to change topic, inside the paragraph, she just says, I really like this. She just says, what? Socially.
Socially.
That's nice. Or you could say, with regards to
social background.
Social background, right? Comma. You just need to tell the reader that you're changing slightly the topic. It's still background though, isn't it? So it's okay. Still the same function. It's like giving us context. Just having context. It's not the main issue. All right, what about I'm going to get to the more interesting ones in a minute. Let's just do request para. The purpose of a request para again is to, let me ask someone here, put you on the spot. Austin, Susmita.
Tell the reader about what we have to do, what he has to do next.
Yeah, the main thing is tell the reader what they must do. It's actually a bit more complicated than that. Okay, I was giving you a simple one before. What about if I say, please note that she must, please note she has an appointment next week. Am I telling the reader what they must do next?
No, actually just giving information.
Give information that they, what? They might, come on guys, help me. If I say, please note that she sometimes falls down. Why am I saying that?
So that
they need to be aware.
Monitor for that.
To know, yeah. They don't need to do anything necessarily. If I say, please note that she has an appointment next week, I don't need to do anything, but maybe I can remind her if I'm chatting with her, something like that. So we tell them what they must do next, but we also give information about what they might need to know. What else is the function of a request paragraph? Is there anything else? Think about it. I always say at the start, you should say, in view of the above, it would be greatly appreciated if you could provide. What do you want to say in that first sentence? It's a good idea to restate the what?
Intro.
The purpose.
Restate the general purpose. Don't you see that's a great idea? Yeah. Don't give me too much detail in the first sentence of almost anything, right? So please provide for. In view of the above, it would be greatly appreciated if you could provide further care and support. Look, Tinsy's doing it here. Care and support. You see, she's restating what she said in her intro because she doesn't want the reader to be confused about the purpose of the letter. Good practice. Okay. Let's get on to some more interesting ones now. Timeline paragraphs. What do we need to do to make a good one? It's the most difficult type. I hate it because it's so complex. Sometimes it's really big like this. What makes a good story paragraph? Can anyone tell me? A good timeline paragraph. Open mic now. I'm sure you've got some interesting things to say about this. Who wants to tell me? What makes a good one?
Is there a difference between timeline paragraph and a story paragraph?
It's just exactly the same. It's just I think story can be misleading sometimes, right? It's a bit informal, the word story. Timeline just means it sounds more official, right?
So it's one and the same thing then?
Yeah, I'm using them interchangeably. Yes, good
Okay.
question. Story paragraph. The story is just the idea that you're trying to tell a story about what happened to the patient. But timeline gives the idea that I need to get the events in the right order, right? To make it clear. So come on, guys. I did a class last week. What do we need to do to have a good story paragraph? Maybe Anna.
Linker.
Oh, someone said linkers. That's what I want. Who said linkers?
Mukit.
So Mukit, words like linkers, you mean like kind of yes and no. We don't need linkers so much in the story paragraphs, do we? We need dates. What else do we need?
Sequence.
Sequencing language, like, such as what?
After, following with, following this.
In this hospital.
So after
Shake.
Shake. Microphone off, please. After, following, something like that. What else do we need?
Different tenses.
Duration.
We're usually in the past tense, past simple, but you can change the tenses, but it's usually just past simple. Duration phrases, right? Like what?
During the hospitalization, during his time.
Good. What else? I want to give the reader a sense that time is moving forward, right? I want the reader to understand what happened first, what happened second, what happened
chronological?
third. Yeah, it's like, in general, who said chronological? The purpose is to make the chronology. What does chronology mean?
Sequence.
I'll say sequence because people might be more. Sequence of events clear, right? We do that by using dates. We do that by using the words after, following. We use duration phrases. What else do we do? Look at the
language.
example. Yeah.
Results language.
Results language. Results language. So, oops, how much results language? Let's take some examples from here. You can see some examples. So I used this last time. Dates, you can say on, in, but can anyone see here a really nice way to use dates? I showed you this last time. Imagine I want to talk about
from November 2016.
That's good, isn't it? From X to Y. That's quite good. Does anyone remember last class when I spoke about if you want to talk about the final months of a year, what could you say?
Around middle
end of
the year.
End of the year.
Towards the end of the year.
You can say things like towards the end of February, towards the end of 2018, Mr. Jones had a number of issues with compliance with his diet, right? Towards the end of. You can, of course, also say on, right? On. Do I want to write dates like this, guys? 10.
No.
Is that good?
No.
I'm still surprised. I keep seeing this. We don't want to do this. We want to say what?
10
of October.
January. Oh, sorry, I'm terrible. This is the month of my birth. I don't even know it. October 2020. So dates, sequence, after and following. Where does this person use sequence language here? Can you see it?
After this.
As a result.
Honestly, I can't stress how much just a phrase like after this can really help the chronology of your paragraph, right? So Mr. Jones was admitted to hospital with chest pains.
But why is this
result of
patient name different?
Sorry, go on, Han.
Different patient name, Mr. Green and Mr. Dunbar.
Yeah, this is a bad. Sorry, this is. I just took this from my thing very fast. Okay, so you're right. We've got two people there. Apologies. This should be. Is it all Mr. Dunbar? Yeah. Okay. Ignore that, Mr. Dunbar. Thank you, Han. Mr. Dunbar. Okay. So what else have we got going on here? We've got after this. Can anyone tell me what's the other sequencing language after this?
Following his
discharge.
Yeah. Good.
As a result of?
Well, that's results language, isn't it? So results language, let's talk about that. So where's the results language? What does it say?
As a result of this.
Yeah, right. We do this in the grammar classes all the time. This is why you OET people, right? As a result of this. Due to which? right? That kind of thing. Anything else?
At that time,
During this
Oh, who
during
said
the
at that time?
it's Mariam.
It's really lovely, isn't it? And at that time is almost a slightly different, it has a slightly different meaning. What does it mean at that time, guys? Anyone know?
It means like when I refer to the past.
Give us a sentence, guys. Listen to this, because lots of the doctors use this phrase, and it helps to make it clear again.
Yeah.
Could you give us an example?
Yeah. Mr. Green has been diagnosed or was diagnosed with diabetes since like or
So he
for
was diagnosed with diabetes, let's say.
at that time she
Yeah.
was given insulin.
She was given, right?
Um,
She was. So what does it mean, guys, at that time? It's easy, isn't it? What does it
at
mean, though?
specific time when the diagnosis is confirmed, was confirmed.
On that
they
occasion, when it was that time in the past. Yeah. Really, really good phrase that I've seen people starting to use. So the doctors, they taught that to me recently. Okay, final one for anyone who's maybe some of you are thinking, I know some of you are thinking, well, this is all very interesting, Alan, but I know this. Well, firstly, it's an introduction class, okay, so that's just what it is. But I thought I would put something in for you, something new that we can discuss for the last sort of 5-10 minutes. We've never really talked much about current condition paragraphs. I don't think Paul has ever really talked about it. Maybe he has. But I think it's something that we're going to teach more classes on.
Yes, please.
Because it's easy. Well, we were talking in Q&A, weren't we?
Yes.
Hans, you've probably written a fair few of these. Do you think you've got any tips you could give to people for that? Sometimes you just have one paragraph talking about the most recent visit. Maybe we should start off with the function. What's the function of it?
It depends on the case note, you know. Sometimes it's urgent, so I tend to put the chrono order. Yeah, the order, the urgent first.
The chronological order. But this is what confuses me. I think you might be right, but I'm just thinking, isn't it just on the day? There's only one date. Yeah, this is why I think I'm going to start saying that this is slightly different, because there's only one day. How can there be a timeline? Even though you're right, there are different tenses. Let's think about how we can write a good one. What are the challenges that come with a current condition paragraph? Have a think. You've got an example here. Today, the removal of our IUD was tried, which was unsuccessful. There was difficulty in locating its strings. Possibly it has shifted to the fallout. In addition, a pregnancy test was done, which maybe, let me show you here. Look at that last sentence. Should it be was or is?
I think was, because today is the day of remove the catheter or something.
Yeah. There's always this problem, isn't there? Yeah, then the pregnancy test result.
I think, because it's fact, it's something like
in the past.
But we're trying to give the current condition, aren't we? That's the purpose of this kind of paragraph. So I don't want to spend too long, because you could probably do a whole class on this, but I've had lots of people say, do I put that in the past or the present? What do you guys think? If this was today, should I do everything in present tense? No. So it's past simple, right? So use past simple. But when do we not use past simple? There might be some situation where we might want to use the present tense.
No.
It's the current condition, isn't it? It's current.
Perfect.
You can use present perfect sometimes in a current condition paragraph, like, go and give me an example. He has been prescribed. Yeah?
Yeah, correct.
Analgesics. What else can we use, though? What about present tense?
Continuous.
Continuous.
You could use continuous, right?
Now able to work independently.
He is able to walk. Yeah, good. Walk independently. So I think
test results, maybe.
Yeah, good. So test results, would that be past or present?
will be present.
His test results reveal? Ooh.
Yeah.
What do we think? Is it past or present? His test results reveal that.
Past.
Because it's true
Past,
now.
simple.
Well, we have to
Awesome.
ask ourselves, don't we? Is it true now or not? Okay, so I'm not going to go too much more into this, but I think one thing to watch out for, I'll do a class next week on this, is that I think current conditions are really tricky because the function of the paragraph is to tell you about the current condition, i.e. now, the state of the patient now, but you have to use some past tense, right? But you might have to use some present tense as well. Han, he is able to walk. Why did you use the present tense there?
So his
He's able.
condition now.
Yeah, it's like still true or something.
Still he's able.
Still true now. Maybe could we say that about some symptoms? Or do we have to use the present tense for some symptoms that are still true at the time of writing?
Yeah.
Would I say he was afebrile or he is afebrile?
Depends.
Today.
It depends.
Well, it's only today.
Yes, today
Have you
is
recovered?
Past.
I think you might have to use the present tense, right? Okay, good. So this is something new for anyone who's a little bit of food for thought, and I'm going to do a class on this next week. I'm assuming Paul's going to want me to do some OET classes. So let's just quickly review and then we'll finish off. Let's go from the start. What is a paragraph function? What am I talking about? Paragraph function, remember the eggs? What is paragraph function? I'm going to put someone under pressure. Or Steen, can you help me out here? Or Hala as well? Oh, sorry, I didn't see you there, Hala. We're just going to do a basic review, okay? Yes. I know it's dead simple. Some of it might be really simple, but let's just go through it again. So, what is paragraph function? It's just the purpose of the paragraph, right?
Yes.
Guys? Okay, so most paragraphs have a function, okay? But why is that relevant to OET? Hala? Why is that important when it comes to OET?
Because it must be direct to the point so the reader can understand what we are writing.
Good. And why did we say this was a problem? Can you remember this mixed one? Why is that confusing?
I came in the half past.
Oh, right. Sorry. Okay, let me ask someone who's here a bit earlier. So let me ask Carol. We don't want to mix our paragraph functions because
the reader might lose focus on what you're
exactly
talking
right
about in that paragraph.
And we had a great example of that, didn't we? If you lose sight of that, you might end up writing a paragraph like this, where you've got background and story completely mixed together, and it's just very hard to make sense of it, right? However, if you just pay attention to this fact of paragraph function, you can quite easily make something like this, which is a really lovely letter. All right. How does this relate to the OET sandwich, though? Why did I suddenly start talking about that? Can anyone tell me? What is an introduction paragraph?
Explain the purpose of the
purpose.
Yeah. It's just a function of a paragraph, isn't it? And the function of the paragraph is to tell me the situation, tell me the purpose. If you don't do that, then your paragraph's not going to work very well, right? Again, requests, it's just another paragraph function, isn't it? It's just a function of a paragraph. What's the function of requests, guys?
Telling the reader what to do next.
Yeah. And I won't go into what we've just done here. I showed you lots of different examples of paragraph types, but anyone who's watching this class and maybe you're new to OET, the main thing for you to remember is you need an introduction. That's a paragraph function that you definitely require. You need a request paragraph. You definitely require that paragraph function. But you have freedom inside your sandwich, right? I'm not saying these are the only functions you can do. If you want to think of your own one, like for example, I've seen people write medication paragraphs. It's just about medication. You think, is that allowed?
But only.
Yes, it is.
No.
You can do whatever you want, right? Oh, microphone's off, please. Thank you very much. So yeah, inside your sandwich, you can have whatever paragraph functions you want. These are just the most common ones. We tend to have background, we tend to have current condition, we tend to have timeline paragraphs. Okay. Thank you very much, everyone, for attending. I hope it was useful. Are there any questions you want to ask me about all this stuff?